Hello everyone. I am Dr. Brij Makkar from New Delhi and currently the President-elect of RSSDI. It is indeed a great pleasure to have presented today the revised version of RSSDI clinical practice recommendations for management of type 2 diabetes in India. As you are aware, RSSDI came up with the first consensus on clinical practice recommendations for India in 2016, and since then every 2 years RSSDI has been revising the guidelines or the consensus recommendations to update them and keep them as updated as possible, keeping in context the recent advances in the field of diabetes and related disorders. The idea of having a clinical practice recommendations paper or consensus paper is to have a standardized treatment available for all the diabetes people across the country. We know we have a phenomenal population of diabetes. We have more than 74 million people with diabetes in India, and most of them are not treated by specialists or endocrinologists. In fact, most of the people with diabetes are barely able to reach primary health care also, and mostly are managed by primary care physicians. So it is very important to have some guiding principles for those people to provide the best possible care for the people living with diabetes in India. And with that aim, the RSSDI clinical practice recommendations are updated every 2 years to provide the best possible options for managing people with diabetes in a simplified manner, so that people in the primary care or the general practitioners are able to provide a very standardized diabetes care to people with diabetes. In the current guidelines, we have included most of the latest advances in the field of diabetes. We have updated all the literature. We have included 5 new chapters, and there are total 26 different chapters addressing multiple aspects of diabetes management and helping our fellow colleagues, whether they are primary care physicians or specialists or endocrinologists, in managing diabetes better for the patients and ultimately benefiting the people living with diabetes. Thank you.